As a healthcare professional, you're going to have to interact with a variety of different people. Therefore, a key skill you're going to need is to be able to adapt your communication accordingly to provide the best possible service and care for your patients. Consultations for Health, helping you progress in communication skills to optimise the care of your patients. Our mini-series, Talking To, looks at specific situations to help build upon skills formed from our consultations basics to guide you through some common scenarios you may encounter. This video will be focused on dealing with emotional patients, and though this is a broad term, we will be concentrating on common situations like where patients are angry or sad. Please remember, there are no tick boxes when it comes to talking to emotional patients, as every situation is different. This requires you to be able to modify your approach whilst maintaining the fundamental basics of a consultation, such as building rapport, gathering and giving information. Talking to emotional patients may seem overwhelming at first, but with practice and some confidence, it becomes easier. Let's look at some scenarios.
This patient has come to the pharmacy to collect her medication for her tonsillitis.
Hi there.
Hi there, how can I help?
I'm here to collect a prescription.
Okay, what was the name?
Kelly Tran.
Okay. Okey-dokey, what was the address for me?
14 Flat Days.
Brilliant, thank you. Okey-dokey, so it looks like we received a prescription yesterday. Does that sound about right?
Yeah, that sounds right.
Okay. So unfortunately, once we scanned the prescription that came yesterday, we actually realised that there was a mistake on there, so we've had to send it back for a new one.
Yeah, that's what you told me yesterday.
Okay. Unfortunately then, it looks like the doctors haven't got back to us with it.
Are you being serious?
No, unfortunately not. We still haven't heard anything from them.
What do you mean? That's their mistake. They need to rectify it as soon as possible.
Absolutely, and we've told them exactly the same, that obviously we want to get you your medication as soon as possible.
Are you? Oh my god.
But unfortunately, we did contact them again this morning, and they still haven't got back to us with what we need.
So you've contacted them twice and they haven't said anything?
Unfortunately, yes.
But I literally have tonsillitis. You have me running around, going to your pharmacist, going to the doctors. I just want my antibiotics. Okay. Like, what is this? I'm literally dying. I feel like I'm literally dying right now, and I'm having to come back and forth to here. Like, sort it out, honestly.
Yeah, okay. And obviously I can see that you are frustrated and you're likely in pain and you don't want to be doing this. I completely empathise with that, but unfortunately, if I give you what they sent us, it's going to make you a lot worse.
But why are they making the mistake in the first place? Do you not have it on your records that I'm allergic to penicillin? Like, oh my gosh, this is ridiculous.
As I said, I am sorry, this is an example of poor communication between us, and this is something that we would like to rectify in the future. But in terms of what we can do now for you, we're still waiting for them to send us back something else. So as I said, we contacted them this morning. I can't personally give a time frame of how long they're going to take. What sort of option, would you be happy to wait for them? So
I don't know what I'm going to do. I just need my antibiotics. I'm literally like in pain constantly. I just want my antibiotics.
Okay. If that's the case, then I would strongly recommend that you either give 111 a call, try your local GP, or maybe go to the local walk-in centre.
So you want me to do more running about, basically?
I am really sorry, but
oh my god.
Unless you're happy to wait, and I can't give you a time frame, all I can do is say that we hope it will be here by the end of the day.
Can I contact them?
You are more than welcome to contact them, but unfortunately, as we've already done it, it may not speed up the process at all. What I can do is I can make sure we've got your mobile number and give you a call if the prescription comes down later this afternoon.
Yeah, can you please?
Okay, so we do have your number on record, so the moment we get that new prescription come down to us, we'll give you a call, and hopefully it should be by the end of the day. But if you don't hear anything from us, probably by about 3 PM, I'd recommend you go to the walk-in centre, just because that way you'll definitely get seen, you'll definitely get something today.
Okay.
I am sorry that this has happened. Is there anything else I can help with? So any pain management?
The whole reason why I went to the doctors, I was literally over the weekend, I couldn't even go to the GP, then I had to go on Monday to get my antibiotics because painkillers weren't doing anything.
Okay.
Oh my god, okay, yeah. Please just give me a call.
Okay, alright, we'll give you a call as soon as we can, alright?
Thank you.
When encountering an angry patient, it is important to de-escalate the situation, so you must always stay calm even when the patient isn't being fair or appropriate in their actions. Looking out for warning bells like their tone of voice or body language can help you identify if the situation could escalate. Empathy plays a big role when talking to emotional patients. If you can try and find out the source of the patient's emotions, this will help you to really understand their feelings. One way to do this is allowing them to have an uninterrupted say. This will enable you to actively listen and pick up on the information that will aid you through the rest of the consultation. You can then verbally acknowledge and validate their feelings. Methods to do this include mirroring their words, e.g., I see you are frustrated, irritated, annoyed about this. Always apologise using good communication skills, explaining the situation, offering options, and using open questions to encourage him to discuss other issues. Our video on being validating in practice and open and closed questions can aid you further. It is also important to be firm, as you may be in a situation where the role of your job limits the help that you can provide for your patient. So establish your role and remit. If the situation escalates and you do not feel comfortable, you must indicate what is appropriate and, importantly, what is not. Let's look at another scenario.
The patient has returned and asked to speak to the healthcare professional in private.
Brilliant, that was the right address, thank you. How can I help?
Just before we start, I just wanted to apologise. The other day I came in and sort of had an outburst towards you.
Did you come in for some antibiotics by any chance?
I did.
Yeah, no, that's absolutely fine. I do remember you, and thank you for the apology, but that must have been a really stressful situation, so I do understand.
I just wanted to apologise.
Thank you. So how can I help today then?
It kind of plays into this. I just haven't been feeling myself recently. I feel like I'm very stressed out and just on edge all the time, and yeah.
Okay, so you've been feeling stressed out, on edge. Okay. Do you want to tell me a little bit more about what's going on?
I mean, I think I know where it comes from. I recently lost my father, and I don't think I've been able to grieve properly because, you know, life happens. But I think it's been affecting me in the way that, like, I'm acting out towards other people, including like yourself, and it's just not really, like, it's just not who I am, and I think it's just making me feel really low, and yeah.
Okay, I'm sorry to hear the loss of your father. That must be a really difficult time for you right now.
Yeah.
You're saying that your relationships are you're feeling a bit more on edge, a bit more angry towards people, more outbursts. Can you tell me a little bit more about that?
Like my mum, I'm really rude to her, constantly as well, and sometimes I forget that she's also grieving someone as well. It just makes me feel really sad sometimes that I treat my mum this way. I don't know, I just feel like I just don't feel right in the head, and I don't know, like, especially just taking that on my mum. I don't know, I really don't know.
Okay, you're doing really well, by the way. I know that this can be quite difficult to talk about, but coming in and sitting down to me can be a great first step. What sort of direction do you see this going in? Like, what sort of help are you looking towards?
I don't know, like, you know, a lot of people say when you're like feeling like this you should go seek help, but then I don't really know what the help is. I know there's like therapy, I know some people put on medications, so I don't know, I really I just want someone to talk to about this, really.
Okay, well, you're absolutely right. Coming and speaking to someone, especially if you're feeling this way, it's the best thing you can do, because it can help get it off your chest. It can, you know, we can find a solution together that works for you and what sort of you want down the future. You mentioned a couple of different routes that we could maybe explore a little bit more, because it sounds like you might want a bit more information about what's out there. As you mentioned, we've got the medication and therapy. That is one way to look at it, but there are other things as well. Maybe some that you may not have heard of, so like talking groups may be a good start. How does that sound? Would you like to spend more time, or?
Yeah, I would like to discuss it with you because I think I definitely need to do something about this.
Okay. Are you happy to stay now and have a chat? It'll probably take about 10-15 minutes.
Yeah, that's fine.
Brilliant. So we'll start with the groups if that's okay. So there are some online.
When talking to SAD patients, allow your empathy to come naturally, and you must approach them with sensitivity. Your actions will speak volumes. You need to allow the patient to show their emotions, even if this means you stepping out to allow them to cry or offer them a tissue. Approach them with comforting body language, as they may not want to communicate with you if you are visibly tense or uncomfortable. Building that rapport encourages the patient to feel comfortable enough to truly open up and further share their issues. Allow the patient to have that golden minute where you actively listening, reflecting what they've told you and acknowledging their experiences. Effective communication is essential. A fantastic way to do this is to always acknowledge and validate your patient's feelings and expressions. The patient may not be in the clearest state of mind, so using smaller chunks of information and checking regularly can help you both understand what is going on. Our video on chunking and checking can further aid you with this. Also, try not to use jargon. We don't want to scare them with unfamiliar language. Lastly, try and engage the patient in shared decision making. Starting with a shared agenda gives the patient responsibility. This can make the consultation feel rather more like a chat than an interview. It will inspire the patient to look at options and end the consultation on a positive note. We hope you have found this video helpful, and we would appreciate any feedback in the comments below. This video is only designed to touch the surface of talking to non-adherent patients. Thank you for watching Consultations for Health. Feel free to check out our Facebook, Twitter and other YouTube videos. Don't forget to like, comment and subscribe for more videos in the future.